highest in the world. There are about 1,100 people live in 1 square kilometer on average. And Bangladesh is also the world's worst climate victim. And we began in January 2009. So it's like that. And we used paper computer. This machine can keep its memory 30,000 encounters. So it is connected with a computer, but the computer doesn't actually work always. When the computer is switched on and the operating system is running, it takes all the data to the computer. And our server tries to find this local computer always. So whenever the local computer connects to the internet for checking email or browsing internet, then the data is transferred to my office. So from Dhaka we can see every hospital. So one doctor gets $300, new doctor, young doctor gets $300 a month, right? And this machine costs $300. So if we can just ensure that only one doctor will be available, 1 month, the cost, okay? The rest, 11 months is free. And for all the staff, this is free. So this is the value for the money. So reaching the citizens through facilitating the service delivery with the use of ICT and empowering the citizens for enhancing transparency and accountability. So this is about the mobile phone health service I already told to you. So we have got 64 district hospitals and 421 sub-district hospitals. So total 482. We have provided only one mobile phone. So maybe $25 a piece. So one doctor on duty, he actually carries this phone. And the people living in the casements, they know the phone number. So they can call the phone 7 days, 24 hours. And they can ask for medical advice from the doctors. And the doctors give advice free of cost. Okay. From our headquarters, actually, often we call the mobile phones, any mobile phones, and we try to see whether they are receiving the calls or whether they are behaving well with the patients. We have got telemedicine. We have got actually different kinds of telemedicine. One, actually, we use the Skype. So people living in the remote areas, so they come to a center. We have got 4,500 centers like that. So they come to the centers, and the local operator, they actually launch a Skype call, and doctors sitting in my office, they talk to the patients. Right? In the remote areas, virtually there is no doctors. So currently, actually, we are experimenting in 22 centers of that 4,500, but we are planning that we will have 18,000 community clinics. One community clinics for catchments of 6,000 population. So this will actually spread these services throughout the country. In fact, in the community clinic, we have got only health worker, no medical doctor. But some patients will require advice from the medical doctors. In the nearby hospital, we have got 482 hospitals nearby. So if a patient requires any consultation from a doctor, so they can have a Skype call, and the patients will be able to talk to the doctors. And we have seen that, after maybe a few minutes, the patient just forgets that she is or he is in a remote place and talking to the doctors. So where there is no doctor, even the doctor is not residing closely to the patient, this is a great help for the patients. And we have got also in 8 hospitals, actually, we have got very high quality video conferencing system with dedicated bandwidth. And we are expanding actually every year. This year we'll expand to another 10 hospitals. And by 2016, actually, we can go to all the bigger hospitals to have these telemedicine consultation services. And this is our honorable minister. This is one from Microsoft people. And this one, this person, right? So when he was visiting our office, he just used to tell that Microsoft has developed maybe the computer and the software, but Microsoft did not imagine that this will be used so innovatively for delivering services to the people. We have got another service. This is the pregnancy care advice through SMS. So when a mother becomes pregnant, she can register her, or anybody can help her to register in the mobile phone through text messages. So she uses the last menstrual period and a mobile number where she actually wants to receive the advices. So every trimester, automatically she receives some advices appropriate for the trimester. Maybe at the 3rd trimester, she is advised that save some money, go to the doctor, be admitted in the hospital. So this is how it works. Now with the help of USAID, actually we have added voice to the system because many mothers are illiterate, they cannot actually read. And in Bangladesh, actually, we have to use English language because when people use the English character to say Bangla words, the government discourages it. So, with the addition of this voice to the system, this is very good for the illiterate women living in the rural area.